CCA Exam Preparation 2026 Medical Coding Practice Test, 25 Key Questions. Question 1. Which organization is responsible for the ICD-10-CM official guidelines for coding and reporting? AMA, CMS and NCHS, AHIMA, the WHO. CMS and the National Center for Health Statistics, NCHS, develop the official guidelines for ICD-10-CM. Question 2. In CPT, evaluation and management codes are found in which range? 00100-01999, 99202 to 99499, 70010 to 79999, 10021 to 69990. The 99XXX series in CPT is dedicated to evaluation and management, E/M, services. Question 3. What does principal diagnosis mean in the ICD-10-CM guidelines? The first symptom mentioned. The condition established after study to be chiefly responsible for admission. The most expensive diagnosis. The patient's chronic condition. The principal diagnosis is defined for inpatient settings as the condition chiefly responsible for the admission. Question 4. Which digit of an ICD-10 PCS code represents the root operation? First, second, third, fourth. The third character in an ICD-10 PCS code identifies the root operation, the objective of the procedure. Question 5. What is a V code in HCPCS Level 2 used for? Vision and hearing services, vaccines, vascular procedures, visitor services. HCPCS Level 2 codes starting with V are for vision and hearing services. Question 6. What does the abbreviation NOS stand for in coding? Not otherwise specified, not on schedule, no other symptoms, needs other support. NOS, not otherwise specified, is the equivalent of unspecified and is used when the documentation lacks details. Question 7. Which of the following is a prospective payment system used for hospital outpatients? MSDRG, APC, Ambulatory Payment Classifications, RBRVS, HHRG. APC is the prospective payment system for hospital outpatient services under Medicare. Question 8. What is the purpose of an excludes to note in ICD-10-CM? The conditions cannot occur together. The excluded condition is not part of the condition represented by the code, but the patient may have both at the same time. Do not code this ever. Use only one code. Excludes to means not included here. It indicates that the condition excluded is not part of the condition represented by the code, but a patient may have both, and both may be coded. Question 9. Which CPT modifier is used for a discontinued procedure in a physician's office? -52, -53, -73, -74. Modifier -53 is used by physicians to report a procedure that was discontinued due to a threat to the patient's well-being. Question 10. What is the abstracting process in medical coding? Removing parts of a code, reviewing medical records to identify diagnoses and procedures, scanning documents into the air, summarizing a patient's bill. Abstracting is the process where coders review the health record to extract the necessary information to assign codes. Question 11. What are Category 2 CPT codes used for? New technology, performance measurement, surgical procedures, radiology. Category 2 codes are supplemental tracking codes used for performance measurement. Question 12. What is the MSDRG system based on? The patient's age only, the complexity of the case, including principal diagnosis, procedures, and complications/comorbidities, the number of days in the hospital, the geographic location of the hospital. Medicare Severity Diagnosis Related Groups, MSDRGS, categorize inpatient cases based on clinical similarity and resource use. Question 13. A patient is seen for chest pain, rule out ME. In the outpatient setting, how is this coded? Code the ME as if it exists. Code only the chest pain. Code rule out. Do not code anything until the results are back. In outpatient coding, do not code rule out or suspected conditions. Code only the confirmed diagnoses or the symptoms. Question 14. Which organization created the HCPCS Level 2 codes? AMA, CMS, AAPC, AHIMA. HCPCS Level 2 codes are maintained by the Centers for Medicare and Medicaid Services, CMS. Question 15. What is the compliance plan in a medical office? A plan to increase profits. A written set of policies and procedures to prevent fraud and abuse. A list of employee names. A schedule for cleaning the office. A compliance plan is a formal program designed to ensure the office follows all federal and state laws and regulations. Question 16. What does laterality refer to in ICD-10-CM? The severity of a condition. Whether a condition occurs on the right, left, or is bilateral. The timing of a condition. The age of the patient. Laterality is the side of the body affected. Question 17. A sequencing error in coding refers to using the wrong numbers, listing codes in the wrong order of priority, citing the wrong year of the codebook, typing too slow. Sequencing is the order in which codes are listed. Incorrect sequencing can lead to incorrect reimbursement. Question 18. In CPT, what do indented codes mean? They are the most important codes. They are dependent on the description in the preceding parent code. They are for children. They are deleted codes. An indented code is a subprocedure that includes the common part of the description from the preceding non-indented, parent, code. Question 19. What is release of information ROI? The process of disclosing FI to authorized parties. A marketing strategy. Telling the patient their diagnosis. Publishing a medical book. ROI is the legal process of providing health information to others, like insurance or other doctors, while maintaining HIPAA standards. Question 20. Which of these is a third-party payer? The patient, the doctor, an insurance company like Blue Cross, the hospital. Third-party payers are entities other than the patient or healthcare provider that pay for healthcare services.